We're going to go down to our GMA cover story. A new study finds the medication commonly used to treat HIV may significantly lower the risk of developing dementia. ABC News Chief Medical Correspondent Dr. Narula is here with more. Doc, good morning to you.
Good morning.
Tell us about this study, research.
Researchers here looked at two large databases, over 200,000 patients. They were 50 years or older who had, as you mentioned, either HIV or hepatitis B. They looked at those individuals who got a certain type of antiretroviral therapy called NRTI, and they found that, in fact, those patients did end up developing a lower or had a lower risk of dementia associated. So for every year that those patients took the drug, there was a 6 to 13% decline in the risk of developing Alzheimer's dementia. The researchers estimate that this type of drug could actually prevent around 1 million new cases of Alzheimer's dementia per year. Why is this interesting? Well, we don't have a lot of treatments, if any, to really prevent Alzheimer's. We don't have a lot to treat Alzheimer's, and this really works in a different fashion. These drugs target inflammation in the brain. We know that patients with Alzheimer's, those abnormal proteins in the brain cause inflammation, and these drugs target something called inflammasomes, and really by reducing that inflammation, they're preventing potentially that cellular death and the cognitive decline associated. Now, this was not a cause-effect study, so we do need more clinical trials, but it's definitely promising.
Well, like you said, it's going to take more time to see if the drugs actually slow the progression of Alzheimer's, but any slowing would be good, I'm pretty sure. What options are available right now, though, for someone who may be going through this?
Yeah, so not a ton, right? I mean, we saw the first new drug for Alzheimer's just came out on the market a couple years ago, and that took 20 years to get there. So what we have now are really drugs that target the biology and drugs that target symptoms. So for the biology, we're talking about those anti-amyloid drugs. There's really two on the market in the last several years, and they reduce those proteins or plaques in the brain. They're IV infusions. They do come with some side effects, like in some cases, brain swelling or bleeding. The other big class of drugs targets symptoms. So it targets chemical messengers in the brain that help patients basically function better. Outside of that, we talk about lifestyle things, so exercise, diet, the Mediterranean diet, cognitive stimulating activities, and then controlling cardiovascular risk factors. So we know that things like hypertension, cholesterol, and diabetes are associated with dementia.
Doc, thank you. You always got it down. All right, you always got all the information we need. We really appreciate it.